Yeah, so I'd just like to welcome everyone to Kellogg College. I'm Juliet Carpenter, I'm Director of Research at the Global Centre on Healthcare and Urbanisation, which is a research centre based here at Kellogg College. And we bring together the interests of sustainable urban development. Welcome, do come and have a seat. Sustainable urban development and health and well-being. So essentially what we're interested in as a research centre is creating healthy cities. And so we're really delighted today to have Miriam Schindler to give a seminar on rethinking healthy cities. Miriam Schindler is a global visiting research associate here at the GCHU for a month. Coming from Victoria University in Wellington. And we're delighted to have her here and really looking forward to your contribution. So over to you, Miriam. Thanks.
Thank you, Juliet, and welcome everyone. Kia ora koutou. And before I start, I would really just like to say a big thank you to GCHU for the opportunity to come to Oxford to spend 4 amazing weeks in here at GCHU. For the funding associated with that, and which allowed me, for example, to do empirical research in one of the healthy new towns here in Oxford, and I'll be talking about as well. So thank you so much, especially Juliet, for the introduction. All right, kia ora koutou. We'll be talking about rethinking urban health, healthy cities. When preparing for my visit in Oxford, I was reflecting on the research that I've been doing in the space around urban health, healthy cities, and I was wondering what could I possibly contribute to expert conversations with GCHU team and wider colleagues in Oxford. So I've done a lot of reflective thinking on what my research so far has told me about what healthy cities are, how can we conceptualize healthy cities, and I've been finding myself moving around between different conceptualizations of urban health. We have different models that conceptualize healthy cities, urban health, and I've been finding myself moving between those. So I wondered, what does my research tell me about healthy cities? And maybe there is something that I can propose a new conceptual framework of urban health. And that was sort of the result of my preparation of coming to Oxford. So I'll be presenting on that. Basically, it will be a bit of a journey through some of the examples from my research in urban geography, and then a narrative to why I think we should be thinking about urban health as something that is enacted, that is negotiated, and that is dynamic. All right. I hope this works. No, moving to the next slide. Yes, here we go. So you're all here with an interest of some sorts in healthy cities, so I don't want to talk too much about it. But we know that growing health pressures are associated with our urban areas. We talk about increased heat stress, increased housing inaffordability. We're talking about mental health concerns, lack of engagement potentially with urban nature in our urban areas. So it's becoming increasingly urgent, also because of increasing inequalities that we observe in our urban areas. But the idea around a healthy city is also becoming more contested. What is a healthy city? We know we want cities that are thriving, we have walkable environments, we have social interaction, engagement with nature. So there is increasing vision of health being implemented in planning and on the city agenda. How can we promote health? For example, through the Healthy New Town scheme here in the UK, thinking about planning guidelines on how we can promote health in our cities. So often the conversation about healthy cities starts with planning. How can we plan for or design for health? Yet there remains a couple of tensions that really are the focus of my work. Thinking about outcomes are still uneven. Even if we have planned for walking environments, walkable environments, we see that only some population groups might benefit from planning intervention. Some interventions result in contradictory outcomes, or they're context dependent. They might work very well in one city, but they don't work in another city. Or health emerges very in unintended ways. So design or planning interventions do not necessarily translate into urban health. And that's why I've been posing this rather provocative title for this seminar. To what extent can we actually design or plan for urban health? And I think to do that, we might take a step back and reframe it slightly to say, how is urban health actually enacted? How it is negotiated and how it is shaped within the urban system? And that's the guiding question for my talk today. And just a bit of a disclaimer where I'm coming from. So I'm an urban geographer, so my work is really centered around understanding people have in place, between people in place. I've done a lot of work under the umbrella of healthy cities, but also around concepts of livability, care, resilience, which I think is all interconnected in some way. And I'll be presenting research on the practices of mobility, urban nature, and housing primarily, but acknowledging that there are many other practices that contribute to healthy cities that we care about. But those are just examples that I'll be showing. So you understand where I'm coming from, the contextualization of my talk. And I'll start with examples from housing, which is the fundamental form of our cities. So there is increased housing unaffordability issues in our cities that are affecting mental health and our healthy cities. And in many parts of the world, and especially in Aotearoa, New Zealand, we often have a market-driven response to a lack of housing. We need housing delivered at speed. We need as many housing new units as possible. So we see for example, across Aotearoa, lots of large-scale housing developments popping up. For example, here is just a map of the Wellington region. You might not be familiar with them, but you see the number of new dwellings that are being proposed in some of those locations. You see 1,000 new dwellings, 2,000 new dwellings, just adjacent to existing neighborhoods. So you get a sense of the scale of the developments that are happening. And those are often greenfield developments, and they're driven by one single developer. So the question is, are those market-driven housing delivery schemes promoting health? And my research has shown me that, yes, they do provide great new housing to high standard, but because they're market-driven, they often don't provide the social infrastructure that we care about in healthy cities. They maximize the housing space without leaving much space for green spaces that children can play in, for example. So they do, because they're operating in a market-driven approach, they might not necessarily result in health. One of my PhD students looked at housing intensification and the impacts on urban greening. So if we're thinking about healthy cities, we often think about the urban morphology of a compact city, which is promoting sustainability, accessibility, shorter distances between amenities, and therefore potentially healthier mobilities. And we see that form of housing in Aotearoa as well. But what we found is that housing intensification programs, projects often come with the removal of trees, because again, it's not because developers might be anti-tree, but because of the constraints of operating in a market-driven economy where you can decide between keeping the tree or building an additional unit of housing. So often it's a site constraint, and therefore we see the unintended consequence of removal of trees in urban areas. So I'm showing this example because it kind of illustrates that sometimes urban health priorities are being negotiated in urban areas. So it's housing in this case versus green spaces to some extent, and they're often competing practices, which they shouldn't be. And we need regulation in this case to keep trees as a predominant practice. So urban nature is a big component, a big area of research for me. I'm really interested in how can we promote engagement with nature in our urban cities, which we know has health benefits, environmental benefits that we really want as part of the city. The conversation often starts with how can we provide green spaces so everyone has access to green spaces equally. The WHO, for example, gives a threshold, an indication. We want everyone to be able to walk to a green space or nature space within 5 minutes. So we've done some work, for example, here globally showing that only just a bit more than half the population has access to accessible ecosystems within a 5-minute walk. And you see that there are huge inequalities across the world thinking about who has access. And if we're accounting for different walking speeds, for example, for different population groups, those inequalities are even becoming more pronounced. So yes, it's about provision of urban nature within cities, but we've also done some research around where people actually go to use, for example, green spaces. Where do people engage with nature and therefore receive the benefits of nature? And you see here maps of 3 European cities and residential locations of people that we've asked and where they go to use green spaces. And you can see that they're not necessarily using the green spaces closest to where they live, but they're traveling to some extent half across the city to use a green space that they prefer. And that's because of the quality of green space not meeting their needs. So we really need needs-based green space provision rather than just access-based. And we also found socioeconomic differences between who has to go further and who doesn't. So it's a lot about inequalities within the provision of green spaces as well. So another strand of research that I've been doing is around street trees and understanding, for example, in Wellington, where some of the street trees are located. But then it's also about understanding what is driving the distribution. And I found that it's a lot of the kind of urban layout and the housing and how we provide housing in the city is really enforcing this inequality of where green spaces, where street trees are being planted and where not. So there are amazing strategies around the world, for example, in Melbourne, thinking about we don't not just want trees to be increased in the city, but we want trees where they're actually needed. So thinking about where, in which location, but also who needs more trees. So Wellington, for example, sorry that I'm giving so many examples from Wellington, from out here in New Zealand. So in Wellington, the city has an interesting approach to urban greening governance. It's using a mosaic governance approach, meaning that they want citizens to be part of the greening initiative. So everyone who is a property owner can plant something on the verge, so the strip of land between the road and their property, which is a nice intention. But I've spoken to property owners thinking about who is now engaging in those planting initiatives. Some have a lack of resources, they can't afford to buy trees, some don't have time to engage in planting, but others don't actually care about trees and they don't, they're not aware of the benefits of urban nature in our cities. So even though a mosaic governance approach to greening, for example, is well intended, it can actually reinforce those inequalities of who has access, who has the opportunity to engage with nature in cities. So thinking about those structural constraints as well. And that brings me to the last component here, which is nature orientation, connectedness to nature. So even if we do have amazing green spaces in terms of provision across the city, we have quality green spaces that people want to use. If we don't have the, if people don't have the relationship to nature, they might not even go and use those green spaces, engage with those green spaces, so they don't actually receive some of the recreational benefits, for example. So it's not just about access, quality, but it's also about how can we foster that relationship between people and nature in order for them to then enjoy those benefits. Many of the participants that I've been talking to through the course of my research said that in adulthood, they're actually engaging with nature because they have so fond memories of spending time in the countryside as children. So the early days in childhood are such formative years of kind of establishing that relationship with nature. And that's why we're currently doing a project in Wellington with a couple of primary schools, working with young children to understand what opportunities they have on their school grounds to engage with nature, how they use natural components in their play, but more importantly, what is actually nature to them, understanding how they see themselves in relationship to nature and understanding what is nature. So it's the bugs, it's the insects, it's the spider webs that you see here, rather than just the trees or the playground, which is green. So thinking about what can we do early on, for example, in school grounds to foster that relationship between people and nature in order to then get in adulthood, enjoy those benefits around green spaces. And urban nature is also something that features very prominently in another strand of research that we're doing with parents of young children, where we're thinking of wanting to understand the lived experience of parents with young children and how they're navigating the city, how they're navigating the city through parenting. We know that becoming a parent really shifts our relationship with the city. We're more attuned to the urban environment. We have heightened emotions and those kind of things. So how does it affect our walking and navigation within the city and therefore our health? And we find that walking for new parents is a really important health practice. It's everything so we're thinking about what can we do to increase, make cities walkable for parents. And we find it's not just about the care infrastructures like playgrounds or nice libraries, but it's really how can we foster the people, place, and things relationship, the more than human. Because parents talk to us about the microstructures being important, that there is a puddle that the kids can play in, less traffic, there is a bench for breastfeeding, for example, those kind of more than human elements within the environment, not just the design, but those things that they engage with in a very embodied experience. So thinking about the mundane things. And especially health did not emerge from the presence of such features, but how they incorporated that into a routine. Leaving the house, being able to meet the outside world with a newborn, for example, was something that they really talked about. Incorporating the walking practice as a routine, as part of their rhythm. I just want to show some of those illustrations that came out of the work where you can kind of see some of those examples. If we're talking about walkable cities and towns, it's not just about the inclusive infrastructure, but it's also what you see along the way and children, for example, can engage in, or the socioeconomic microstructures, which are around walking not being something that is a productive time, but it's something where parents can have us care and think about engagement with the environment. So this is just an example to show how important it is to think about the lived experience, for example, in terms of the health practice of walking. Because often we're thinking about health, for example, what a healthy city is in terms of indicators. Thinking about what is a healthy city is an excellent city that is a 15-minute city, for example, has accessibility within 15 minutes to all those amazing opportunities. But if we're looking at the lived experience, and we've done this research around livability, but there is a lot that we can learn for health as well. If we're listening to what people tell us about what makes a place livable to them, it's front and center that it's the connection between people, place, and nature. And that livability, for example, is something that is negotiated. It's negotiated because we're talking about the negotiation of everyday life between the social norms about we want sustainable transport, but we're negotiating that with our own experiences, our own financial constraints, our daily struggles that we need to negotiate. There's also a negotiation around our own identities, our circumstances. We're negotiating how we relate to place, how we relate to other people, given our personal circumstances, our life stages. Livability is something different for someone with a newborn than someone in later stage of life. And livability is also something that is a collective process. It's very much about the community, about governance, about feeling listened to, and having a voice in what happens, receiving care and providing care. So livability is a concept that is really effective, relational. That's what we're showing. It's both focused on the processes that are shaping the relationships between people, place, and nature. And it's pluralistic. For everyone, a livable place might be something different. So it's not about urban excellence in terms of an indicator framework, but it's about everyday viability, understanding how people navigate and negotiate everyday life to make it viable for them. So livability, and I think also health, is something that is fragile. That might be, the place might be very livable this second, but then something changes with the relationships and it becomes maybe unlivable. And it's uneven. Everyone perceives a place differently. So this focus on negotiation, lived experience has led me to think about this in a project that I've been doing over the past couple of weeks, thinking about the lived experience of local residents that live in a neighborhood that has specifically been planned for design, and with design visions in mind. So we have One Healthy New Town, Barton Park, here in the edge of Oxford. which is a new development adjacent to an existing neighborhood, the Old Barton, if you wish. And it was created with visions around healthier mobilities, healthier lifestyle, and the integration of an existing neighborhood with the new developments, which is something very different to what I've showed in the very beginning, the example of large-scale housing developments in Wellington. So I just wanted to understand how health emerges on a daily basis and what is the lived experience of people in a healthy new town. So I did a couple of walking interviews, talking to people about what is important to them. And I've just finished data collection last week, so those are really early thoughts on what came through. But it was just fascinating to hear what the residents had to say. So the first sort of thought or theme, if you wish, is community was really brought up by every single participant that I talked to. Community is really important to them. For some, it's established through the refurbished neighborhood center with sort of formal services around food, GPs, health services, social services, and so on. That was a strong community factor, give and take of support. But the other residents I talk to, they don't even know their neighbors, and they have no sort of social interaction with the rest of the neighborhood. And everything is sort of happening on WhatsApp, which is a group for just the new development, for example. But this is a WhatsApp group that, as I understand, is not for organizing social events and organizing community, but rather to talk about issues like a littering in the street or something, managing the space. Other forms of community, when I did an interview, there was a water fight between a couple of kids going on between several houses. So they're very parallel community practices. And even though the development was aiming to integrate different parts of the neighborhood, but also different social groups, if you wish, they're very much living side by side, and there is explicitly expression that there is parallel lives going on. So yes, thinking about how much we can plan that to integrate. Another example is something that has been mentioned by many of the participants as well, is the design feature of a community garden. And I've seen pictures online how this was thriving a couple of years ago, but now residents talk about this being laying bare and no one knowing what's happening with it. There is no structure around it to socially activate the community garden. And this is very much in contrast to a community garden that is thriving in the older parts of the neighborhood, where it's really a social anchor for community. So it's not just about design and the nice intention to put the community garden there, but it's also how do we activate it if there is no awareness of who's responsible or kind of structures around it. It does not activate the community, if you wish. And the last example is that designing a neighborhood locally is a challenge, and there are so many interdependencies between the local neighborhood and, let's say, the rest of Oxford, for example. So many participants talked about moving to the neighborhood because of affordability concerns, so that's the only place where they could afford a house. But then because of the identities of Barton, many do orient themselves towards outside the community, sending their kids to schools elsewhere, orienting their social life outside of the neighborhood. Also because they say there is not so many destinations, amenities in Barton themselves. But they're struggling, and not struggling, sorry, that's too much. They're negotiating the different identities that are associated with the neighborhood, the new and the old, and the kind of mix of both, and the rest of Oxford. So there's a lot of interdependencies. It's not just this healthy new development, but how does it sit within the rest of the system? So that, I find that really fascinating. All right, thank you for bearing with me. So those are the examples that I wanted to give before I sort of propose that argument of why I think we need to think about urban health as enacted, negotiated, and dynamic. So you might have seen a couple of those theoretical groundings throughout the examples that I've presented from my research. A lot of relational geographies, modern human geographies, planning theory, practice theory, but also feminist geographies and so on. So those are the theoretical groundings that are forming this proposed framework. So I do think that urban health is not an outcome of environments, but it is something that is a property that is emerging off the system. So really much in the relational geography terms, if the system is not healthy, if the relationships within the system are not healthy, we can't have a healthy city. So it's not just about individual health. It's not just about one person being healthy because of a healthy lifestyle or a healthy environment, but it's really about the whole system being healthy in some way. And then I'm proposing that health emerges through the interaction of three dynamics. So first one is the practices, the socio-spatial practices like housing, greening, the lived experiences, the enactment of those health practices. They can be competing, they can be reinforcing, like how community is being practiced, the example of Barton. But then they're also negotiated within the wider constraints of the system. Let's say within the housing is provided in a housing market with, for example, the developer having quite a bit of power in the system, or because of the inequalities that are endogenous to how we're doing urban greening governance, for example. So we're negotiating those practices within the conditions that are structuring it, lots of inequality, for example. Then all of those are also interacting with the wider system, as I've shown in this example of Barton. It's not just the neighborhood itself, but it has those interdependencies in the entire system. Barton is also, for example, affected by climate change in some way, housing affordability, and there might be tensions between housing and greening, for example. So I've tried to visualize that. I don't know whether it comes through very well here. So what I'm proposing is that health is something that is emerging, it's constantly in flux, it's remaking, it's remade through the interaction of those three elements, the practices, the structures, and the wider system. And there might be tensions between housing, for example, and greening, or there might be alignments, or there might be trade-offs. So it's a constant negotiation. It's a very much a relational understanding of health. So you can't have one system unhealthy and then the other one not. So basically, coming back to the initial question of the framework of the seminar is, I would argue that a healthy city is not something that can be built. Yes, of course, design and planning is important. It's kind of enabling those practices. But urban health is something that is continually emerging through the interactions of the practices, the structuring system conditions, and the wider system. So it's something that is constantly, it's complex and it's constantly in flux and in conversation with those elements. All right, I think I've overwhelmed you. Thank you very much.